Dr. Kevin Kavanagh is going to join us now. He's our go-to guy for the coronavirus, and he is also the founder and president of Health Watch USA. That's a national health organization. This would be a good time, I think, Dr. Kavanagh, because we talk to you 3 times a week, but we don't want to do this every time. But tell us what Health Watch USA is.
Well, Health Watch USA is a nonprofit healthcare research policy organization, and we've primarily centered on infectious disease over the past decade, as you well know, Jack.
Yeah.
And we've obtained some national and even some international, I won't say recognition, that goes too far, but at least they know who we are.
Right.
We've published, I think, some very good articles which have really shown in the direction we should be going with preventing the infections.
I just saw on my phone just a moment ago that the president has retweeted a tweet, I guess, that he put out earlier saying that he is considering firing Dr. Fauci. I think that would be a huge mistake. Do you?
Yes, I do. That would be a very big mistake. And when you're in the middle of an epidemic like this, it's really not good to let the public know that you don't have stable leadership.
Right.
You know, if you're going to be firing your generals, usually that means that things aren't going real well. But I do think Dr. Fauci has been on target. I mean, he's centered on paying attention to science, and science has predicted fairly well what this epidemic's going to be like. And as you know, we've oftentimes come up with advisories on this show that were weeks ahead of what has happened or what the advisories eventually were. And it's because you look at the numbers and you look at the science. Unfortunately, some of the numbers don't come out to real late. For example, last week they said the virus has an R0 of approximately 5.7, which makes it very infectious, and it's why the churches needed to be closed yesterday. And I was very disappointed also that some of the churches went on ahead and held services, and that some of our political leaders seemed to defend that sort of behavior. So I think we really do need to start taking this virus very seriously. It's not a political thing. It really is something that we all could defeat if everybody stayed in their house for 2 weeks, and we all could wind up losing if everybody does their own thing and doesn't pay attention to the science. So we really need to start doing that, and firing Fauci, if that were ever to take place, I think would be a huge setback and mistake.
Yeah, I agree with you. So this week, is this, you know, I know every week is an important week, but is this a particularly important week?
Well, I think so, because this is the week that everybody's predicting the epidemic would at least flatten out as the number of new cases. Now remember, deaths is a lagging type of an indicator. If you get a new case today, the death won't happen until 1 to 2 weeks later.
Yeah.
So a lot of it depends upon if control and if the social isolation in the non-New York states maintains a low level and does not start to pick up and new hotspots do not start to form. And if everybody performs like New York did, we'd be in a lot of trouble. But luckily, we've learned, we've seen what can happen. We've done social distancing. We've had a governor that very early on said, stay in your house, do behaviors that are going to isolate you from other people, and the vast majority of people have abided by that. And I think the outbreaks that we've seen in Kentucky, a lot of them have been centered on nursing homes, some of them on churches. So they've been in spots that haven't abided by good social distancing. Now, personally, I think that people really do need to wear the DIY, the do-it-yourself masks. And as I said before, I do think we need to start doing this in retail establishments, maybe starting in grocery stores, early in the morning, allowing special shopping times for people who wear these masks to come in early in the morning and get food after the high-risk category has shopped.
Always good. Do you have a question or comment, Holly?
No, you know, I just was going to ask Dr. Kavanagh really quickly to kind of tell us how he thought we were doing, and he answered that sort of in his last little bit there. But overall, as a country, Dr. Kavanagh, how are we doing? Are you impressed with what we've gotten accomplished?
Well, I'll be honest with you, I'm worried, and I think it's kind of what Dr. Fauci would said. We've got states that are all doing different things. I think we all need to get on the same page, having the same amount of social isolation. One of the big risks that I'm worried about is, for example, what happened yesterday of getting hit by tornadoes and then people having to congregate in shelters.
Yeah.
And you've got hurricanes coming, etc. So the governor of Louisiana was talking about how they're having to do different planning and getting that up and running. So actually, I think the tornadoes that happened yesterday were somewhat of a good thing in the fact that it got everybody aware of this is another danger we've got to prepare for. And of course, if you prepare for it, then you can eliminate or at least severely mitigate that danger. And so I think that that's something to look at. So I do think we've got a long ways to go. I don't think we'll have won this epidemic until we have widespread testing, until we have good personal protective equipment with the hospitals, and we have a public that's bought into the science of what we need to do to defeat this virus. Otherwise, we're still going to have smoldering spots that'll pop up here and there and be going through this for many, many more months. So we need to buy into the science, pay attention to Dr. Fauci.
What about a vaccine? I've heard people say this won't be over until we have a vaccine that we know works.
And I think that that's a very true statement because, again, the infectivity of this virus makes it that herd immunity probably will not occur unless you have a vaccine. Similar to measles. Measles never goes away because it's so infectious. Although this probably isn't as nearly as infectious as measles, it's still a very infectious virus. And the vaccine may take a while. The vaccines have to be tested for safety. And, it's going to take a while. It took a while for most infections. And because this is a new virus, they had to start from the beginning, from the get-go, in order to get the vaccine up and running. It's not similar to the flu, where every year they make a vaccine, and they pretty much know how to do the vaccine to that virus, just modifying it as the virus modifies. So I do think that's going to be a while. And until then, we're going to have to know how to live with this virus and live safely with the virus. And a lot of that's dependent upon getting the PPE and personal protective equipment, and that includes in the hands of first responders. And when I say first responders, I mean grocery workers, delivery people, postal service people. It's not just healthcare workers. And also getting rapid testing. And that will go a long ways. And that's one of the things I disagree with President Trump on, is I think that we need rapid testing for the entire population. We need to know who's had this virus, so who's immune, and we also need to know who's still susceptible to having it and who currently has it. And once we know those three things, that will go a long ways in getting us back up and running.
Dr. Kevin Kavanagh, thank you so much.